aloha. Thank you for joining me here at the International Stroke Conference 2019. I'm Dr. Louise McCullough. I'm the incoming Vice Chair for the Stroke Conference, and here with me today is Karen Johnston from the University of Virginia. She is the principal investigator of the SHINE trial, one of our highlighted trials this year at ISC. Karen, thank you for joining me.
Thank you for having me.
Great. So why don't we talk a little bit about the trial? First of all, what was the main purpose of this trial?
Yeah, so as you know, we've long known that hyperglycemia in acute ischemic stroke patients is common, and hyperglycemia is associated with worse outcome. So one of the things that the SHINE trial was focused on was addressing the worldwide debate of whether an intervention to address that hyperglycemia would improve outcomes. So we assessed whether an intensive intervention with a glucose target of 80 to 130 milligrams per deciliter would improve outcome and be safe in a hyperglycemic acute stroke population.
And we know there's a huge proportion of patients with hyperglycemia, so this is a very, very important trial. Can you tell me a little bit about the design?
Yeah, the design was very carefully structured so that it was highly efficient, and one of the things that we did is we built in a series of interim analyses that were pre-specified, and that allowed us to stop early for efficacy if one group did substantially better than the other, or safety if the treatment wasn't safe, and for futility, which means that if both groups look similar enough that it was highly unlikely that one group would do better than the other, we would be able to stop early.
That's great, because doing these large trials is extremely expensive. So we do want to stop early for efficacy or futility, because that will allow us to do more trials.
Exactly.
So that's great that you put that into the design. Is there any special patient population you were targeting, or?
Yeah, so our trial was conducted at 70 sites across the U.S., with 63 of those sites enrolling at least one patient during the trial. And the patient population was a hyperglycemic population. 80% of the patients we enrolled actually had diabetes mellitus. So it is a primarily diabetic population, all enrolled well within 12 hours.
That's very important too, because their baseline glucose control may be different than somebody who's non-diabetic. So that's actually very interesting. So why don't you go ahead and let us know the results of this trial?
Yeah, I'd be happy to. So the SHINE trial was stopped early at the fourth interim analysis for futility. Okay. So the good news is that our glucose control was excellent in both groups. Both groups got into target quickly, and they stayed in target throughout the 72-hour treatment period. And our results suggested that the aggressive intervention group did not do better than the standard care group, and yet there was an increased risk of severe hypoglycemia in the intensive group. So our data suggest that using our more standard approach with subcutaneous insulin and keeping glucose targets less than 180 milligrams per deciliter is the preferred treatment in these patients.
And that is so important to know, because lowering and having hypoglycemia can also cause major issues. So that's actually very important to a practicing clinician to know how to manage these patients in the acute setting. So how do you think this will change our management of patients as a whole for our stroke patients?
Yeah, I think that these data fill the gap that our stroke community has been concerned about, and specifically the American Heart Association, American Stroke Association guidelines that have called for an answer to this question. We believe that these data will help the stroke community know how best to treat these patients, both in the U.S. and across the world.
Yes, this is an incredibly important trial. It really does fill a gap in our knowledge. It will help stroke patients. It will help improve the care of stroke. This is what the American Heart Association and American Stroke Association is focused on, large trials like this that give us an answer. So I thank you very much for being here.
Thank you for having me.